It's kind of hard to remember just because you don't want to remember it. I tried to make a move to catch the ball, and I felt a complete pop. I knew I tore my ACL. My name's Hunter Dobbins, and I'm a starting pitcher. It felt like my knee completely came apart and then slammed back together. You could have heard a pin drop in the stadium. Having a non-opioid option like JOURNAVX meant a lot to me. I knew that my season was over, but I told them that whatever surgery it takes, whatever rehab looks like, I'm gonna be ready by opening day. So pain management was at the top of the priority list. The first thing I did was talk to my doctor about JOURNAVX, a non-opioid for moderate to severe acute pain. I started taking JOURNAVX after my surgery. If my pain was on a scale from 1 to 10, it never got above a 3. It was able to keep that pain down for me. I had physical therapy, I think, at the 6-day mark after surgery. The first couple weeks were very important for getting my range of motion back. I wanted to be ready to go for opening day. I had to hit the ground running. I couldn't afford pain to slow me down.
Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Please keep watching for full important safety information.
In professional sports, having the power of choice is kind of a rare thing. So being able to make an informed decision with the doctors about JOURNAVX, it meant the world to me. I was prescribed opioids back in college after my Tommy John surgery, and I know that they work well for a lot of people, but they just really were not the right option for me. Being an athlete, injuries and recovery are part of the process, and if any of my teammates go through that experience, I'll recommend that they talk to their doctor about JOURNAVX. It really helped me take the steps to hopefully be back on the field come opening day. I can't wait to step on the mound and listen to the whole stadium go crazy. It can't come soon enough.
What is JOURNAVX? JOURNAVX is a prescription medicine used to treat adults with moderate to severe short-term acute pain. It is not known if JOURNAVX is safe and effective in children. Important safety information. Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Before taking JOURNAVX, tell your healthcare provider about all of your medical conditions, including if you have liver problems. People with liver problems may have an increased risk of getting side effects, are pregnant, or plan to become pregnant. JOURNAVX may temporarily reduce the chance of females becoming pregnant while on treatment. Are breastfeeding or planning to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking JOURNAVX with certain other medicines may affect the way JOURNAVX and the other medicines work, and may increase your risk of side effects. Ask your healthcare provider or pharmacist for a list of these medicines if you are not sure. Especially tell your healthcare provider if you take hormonal birth control medicine, contraceptives containing progestins other than levonorgestrel or norethindrone, as they may not work as well during treatment with JOURNAVX. Use non-hormonal contraceptives, such as condoms, or other forms of hormonal birth control during treatment, and for 28 days after you stop taking JOURNAVX. Medicines that are substrates of the CYP3A enzyme, as they may become less effective during treatment with JOURNAVX. Your healthcare provider may need to adjust the dose of your medicine when starting or stopping JOURNAVX. What should I avoid while taking JOURNAVX? Do not take food or drink containing grapefruit during treatment with JOURNAVX. What are the possible side effects of JOURNAVX? The most common side effects for patients treated with JOURNAVX included itching, muscle spasms, increased blood level of creatine phosphokinase, and rash. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all of the possible side effects of JOURNAVX. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information, at journavx.com.